Probiotic.
I think it's bad for them to take and can potentially lead to liver cancer, believe it or not.
Healthy gut actually causes hair shedding.
Sugar kind of plays a role in creating an imbalance, but that can lead to hair shedding.
Ozempic.
I used to think that any way we can lose weight is great.
Hi, and welcome back to the Jadu Beauty Podcast, where we believe in chemical-free world and a more natural approach to beauty and wellness. Today we have with us Dr. Kevin Yeroushalmi, a gastroenterologist with a subspecialty in interventional and therapeutic endoscopy. His work emphasizes early detection, prevention, and personalized treatment of conditions such as inflammatory bowel disease, IBS, and other disorders of the gut. Dr. Yeroushalmi was handpicked for an advanced endoscopy fellowship training at HCA. It is one of the most competitive GI subspecialty fellowship. Welcome, Dr. Yeroushalmi.
Thank you for having me.
Absolute pleasure, and I'm so excited about this because like every other woman or every other person, every one of us has some sort of a GI issue, especially as we get older. Tell me why medicine?
Yeah, so medicine really came about in grade school, I would say. I was always interested in math, science, engineering, and it sounds cliche, but I think a lot of it had to do with wanting to make an impact, a tangible impact on everyday people's lives. And for that reason, I felt like medicine was my calling. Again, I know it sounds quite cliche, but I really like going to work every day and making an impact on people's lives.
And plus, you're known to be an extremely compassionate doctor. So you must be a people person and you must just like have a good rapport with your patients. Why GI?
So GI, in my eyes, is the best of both worlds. It has everything I'm looking for in a specialty, and that is I like to have patient-centered approach in which I follow my patients over a long period of time. And above and beyond that, I like a subspecialty or specialty that has hands-on activities. So for that reason, in GI, we have both of those things. I have patients of mine, for instance, with inflammatory bowel disease or IBD that I've followed for years, if not almost about a decade at this point. And then on the other hand, 2 to 3 days a week, I'm in the endoscopy suite. I'm doing my endoscopies and colonoscopies. So I feel like it's the best of both worlds in my eyes.
You went to Colombia. That's a pretty tough environment.
Yes.
Tell us about your experience in Colombia.
Yeah, so Columbia University, it was a great undergraduate experience. I will say it was quite rigorous, being there for 4 years as a biomedical engineer, but I loved it. I learned a lot. I thought it was a great learning environment, and it kind of served as my backbone and my foundation in order to go into medicine ultimately. So I'm very appreciative, and it was a great experience.
So I would like to talk about advanced endoscopy. For our listeners out there, describe it to me and tell me what is the difference between advanced endoscopy and
general
old-fashioned endoscopy.
Yeah. So for instance, for endoscopic ultrasound, we look into organs that we might not be able to see on an upper endoscopy, like the pancreas.
Yeah, that's what I wanted to ask you, because while I was reading about this subject, pancreatic cancer is known to be a silent killer. And unfortunately, every time that somebody finds out they have it, it's already towards the end of the stage, like stage 3 or 4. In your opinion, knowing that, you wouldn't think that most people should get advanced endoscopy?
It's not really meant for someone who's considered low risk. In general, most people are considered low risk for this. And cost is also a big issue here. So the reality is that we don't screen for cancers or other illnesses that are generally of low prevalence, which means that we don't see them so often. But for instance, if we talk about colon cancer, the prevalence is much higher. So there are screening examinations for colon cancer, for example, colonoscopy, or something called FIT testing, which is a stool-based test. So those are considered more prevalent, and for that reason, they're there are screening examinations for everyone over the age of 45, for instance, for colon cancer.
How has an advanced endoscopy changed with patients who can avoid surgery?
This is a great question. So there are a lot of ways, and they're evolving every year, if not sooner. There are three that I think are worth mentioning right off the bat that I'm kind of thinking of. So number one is for huge colon polyps or even colon cancers, early stage of colon cancers. There are certain types of resection techniques called EMR, or endoscopic mucosal resection, or ESD, endoscopic submucosal dissection. These two are techniques that we use in order to kind of do quote unquote microsurgery, if you want to call it that, to avoid the patient from undergoing actual full-blown surgery where they have to remove part of their colon. So what we do is through the colonoscope, in other words, with an instrument, with a colonoscope, we're able to enter in the normal fashion and use tools through the scope in order to resect that area that's diseased or that has the cancer or a large polyp. So this essentially, as I mentioned, can avoid them from having colon surgery, which in my eyes is a big deal.
It is amazing. Let's go to another subject that is everyone's favorite. It's IBS, irritable bowel syndrome. What is it exactly?
So IBS is really what we call a diagnosis of exclusion. In other words, there aren't specific tests that we can do in order to pinpoint definitively that someone has IBS. It is under an umbrella of conditions that we call disorders of the gut-brain interaction. So we know that there are tons of nerves and neurons in our brain. What many people don't realize is there are many nerve endings in your GI tract, similarly to in your brain. And that interaction between your brain and your GI tract can potentially lead someone to have this condition we call irritable bowel syndrome. And there are essentially three types: IBS-D, meaning IBS diarrhea predominant, IBS-C, IBS constipation predominant, exactly, and IBS-M, which is mixed. You have alternating bouts of diarrhea and constipation. Many of these patients also complain of things like abdominal pain, bloating, cramping, and so on and so forth.
Is it driven from stress?
We think stress has a role here. We don't know the exact interaction, but I can tell you offhand that many of my patients tell me that their symptoms are worse in stressful times. We think hormones may potentially play a role as well. So people, sometimes females of reproductive age, sometimes say that during their menstrual period they can have a worsening of their symptoms. There are many potential factors that play a role here: anxiety, all these type of things.
So would antidepressant or anti-anxiety meds would help in this situation?
I would say that it's not for everyone. It's not my go-to. It's not the first thing I go to.
What is your first go-to?
Personally, I like, very good, excellent, what we call diet and lifestyle modifications. So there is certain diets that have been shown to be effective for these people. It's what's called the low FODMAP diet. So FODMAP. So FODMAPs are these oligosaccharides and monosaccharides and so on that we think cause fermentation and furthermore can cause additional bloating and gassiness. Which,
so describe me this diet, like what's in that diet, let's say.
For instance, legumes.
No legumes.
Yeah, exactly.
So no high fiber diet.
You have to be mindful of what type of fiber you
What
eat.
fiber,
Yeah.
But mainly, I mean, you think yoga, exercise and stuff.
Certainly,
does help.
yes.
The gut. What are the top signs someone's gut is inflamed?
So this question, I think, is best to be kind of split up. In other words, so there are clinical signs and symptoms. In other words, they're quite nonspecific, but inflammation can be found in the form of abdominal pain. Sometimes they have persistent diarrhea, blood in the stools. There are very nonspecific signs and symptoms as well. For example, unintentional weight loss or fatigue and malaise. These play a role. That's the clinical side. But from a laboratory side, in terms of blood work and things of that sort. So if someone is anemic, that is, again, nonspecific, but that can suggest some amount of inflammation. If we see increase in their platelet count, that too can be something that tells us that. Certain nutritional deficiencies or vitamin deficiencies. The most sensitive test for inflammation in the colon is actually something we call fecal calprotectin or stool lactoferrin. These are stool tests that we can send to specialized laboratories in order to see whether or not there's some amount of inflammation going on in the colon. So that's very helpful as well. The two last things that I like to look at, which is all complementary to one another, is imaging tests. For example, CAT scan. If you have some sort of thickening in the lining of the wall of the colon, that suggests there may be some amount of inflammation. And lastly, the best way which we could really take a look and make sure whether or not there is some amount of inflammation or not is through colonoscopy or endoscopy.
Do you think an unhealthy gut actually causes hair shedding and thinning of the hair?
I do. I personally think that inflammation in the gut can lead to, again, nutritional deficiencies or vitamin deficiencies, particularly things like iron deficiency, which we know is very important for oxygenation of our body, including the oxygenation of our hair follicles. So that can play a role. Zinc is very important in our body as well. We know that zinc is very important in terms of keratin synthesis and furthermore for the integrity of the hair follicles. So again, a lot of inflammation can lead to malabsorption or maldigestion, which can lead to these vitamin deficiencies, which can cause a lot of issues.
Does the gut control scalp inflammation too?
I think so. So there is something we call essentially the gut-skin axis, meaning there is some sort of direct connection between our gut inflammation and our hair or skin growth, the quality of our skin. And, this interaction between the two, the bacteria within our GI tract, particularly our microbiota, or in other words, the good bacteria and the bad bacteria in our GI tract, plays a role with our digestion and with our absorption of foods and nutrients. And I think that plays a role in how our skin as well as our hair.
Here at Jadu, we believe in a chemical-free world. Anna, our founder, started this company because she wanted to have a life of chemical-free as much as possible, because in her own experience, she has seen what it could do. So in your opinion, do you think those chemicals, any chemicals, do affect the GI, the stomach, the colon, all of these conditions that you were talking about?
I think, we know for a fact that the incidence of colon cancer, for instance, is increasing in younger population.
Yes.
And for that reason, the guidelines have changed in terms of when we should screen these patients from 50 to 45. A lot of this, in my opinion, has to do with the environment and with what products we're using and chemicals and so on and so forth.
Probiotic. Yay or nay?
So I don't think there's a straightforward answer to this. Many of the societies, many of the GI guidelines do not recommend nor refute the use of probiotics. My personal viewpoint, I don't necessarily recommend them to my patients. If they ask whether or not I think it's bad for them to take, I don't say I think it's okay. I think there are a certain subset of patients that do benefit from probiotics. For instance, those that are at risk for an infection called C. diff or Clostridioides difficile. Yeah. It's something that can be caused by antibiotic use. We used to think it's only in the hospital setting, but now we actually see it in the community as well. So those at high risk for development or contracting of this infection are recommended to use probiotics. That's probably one of the few indications where probiotics are recommended, although the evidence is still weak. Everywhere else, we don't really know how much it helps or hurts. We don't really think it hurts, but we don't know how much it helps for someone that has a well-balanced diet and is doing their regular exercise and eating well and so on and so forth.
I know there are many different forms of probiotics. Some are in refrigerators, some are not. Is there a difference between them, or is it?
I personally don't think so. I think that really whichever one you like as the patient is okay with me. Right. I will say that, again, based on the indication, there are certain studies that suggest there's a specific type of probiotic or specific type of bacteria that you should be looking for, that specific organism in a certain concentration. I think that if there's a strong indication for probiotics, I'm all for them. If you find that your symptoms are improved with probiotics, I'm all for them. If you don't find any benefit with use or not use, then I would say, my personal viewpoint, it can't hurt. We don't know if it really helps for the average Joe, let's say, but I think there are certain indications where it is worth it. So for instance, in the case of C. diff or avoidance of C. diff, there are certain probiotics that you'd like to look for in your probiotic supplement. On the other hand, there are studies that suggest that for young newborns and babies, for colic, there are certain probiotics that might be beneficial as well.
Let's move to another subject that everybody and his mother is excited about, Ozempic.
Yeah.
How do you, I know a lot of people are using them for weight loss. Not necessarily obesity, just weight loss. Okay. Does it damage the stomach lining and the stomach if you take it for that reason?
Glad you asked this question. So we don't think so. What we think it does is it basically, and we spoke a little bit about this earlier, so it inhibits or slows down the propagation or the progression of food from our stomach into the small intestine, into the bowel. So essentially what it's doing is it's causing what we call gastroparesis, more or less. So it's causing the slowing down of our stomach so that we feel full faster, and as a result, we eat less. That's more or less the mechanism by which this medication works. So I don't think it affects the lining per se. I don't think it causes damage to the stomach per se, but it's more just interaction with the stomach so that you feel full faster and you don't want to eat as much.
So it doesn't damage anything. So if people are doing that, it's not necessarily a bad thing. I'm not talking about, no. I'm not talking about, I'm just talking about in medical ways.
Sure. So I think this medication is great and its indications are becoming more and more broad. I think, again, similarly to how we were discussing for probiotics, it has a certain indication. And if you meet those criteria, that indication, it's a great medication. But it's not for everyone. There are certain side effects that you must be aware of. There are certain people that should not take this medication. But all in all, I think it's a great medication. And so far, based on the evidence that we have, it seems to be working very effectively.
Yeah, I remember in the beginning when it came to life, a lot of the doctors used to say, no. But now even OBGYNs and the gynecologists, the doctors for metabolism, they're actually starting to recommend it more and more, even for menopausal women, because they believe that it has benefits. So it's not so taboo anymore as it was in the beginning when everybody was so judgmental of this drug.
I agree with you.
Which chemicals in our food harm the gut the most?
Okay, so there are certain type of chemicals called aflatoxins, and these are found in things like nuts, tree nuts, things of that sort. We know these have a direct impact on our liver and can potentially lead to liver cancer, believe it or not.
Nuts?
Correct. Now, it's not in all nuts. Be aware that these are found very, very, very microscopic amounts, if any. Now, the processing that we have here in this...
Any particular nuts?
We think peanuts are one of them, right? But again, here in these in the U.S. and developed countries, we know that they do certain special processing to avoid these toxins from remaining within our foods and within our nuts. Other chemicals I think we should be aware of: mercury in the form of our fish that we eat, certain fish and meats. That's very important as well. And arsenic. Arsenic is found in certain meats as well. That can be very detrimental to our body as well.
Chemicals in beauty products absorbs and affect the gut inflammation, as what you said. So anything that has chemical may cause inflammation.
Right. So we don't know the exact mechanism at times, but things we place on our skin are absorbed through
Because it's our biggest organ, correct?
That's exactly right. That's exactly right. And it goes into our bloodstream and it can move elsewhere throughout the body. We know this for a fact. And there are certain chemicals that are commonly found in certain cosmetic products, such as parabens and so on. And we know that these have a direct correlation with certain types of cancers and so on. So the fact that this product is clean, and it doesn't use processed chemicals and so on and so forth is a huge plus.
What food immediately supports the gut health, in your opinion?
You hit on this a little bit earlier, but I'm all about fiber. So fiber, specifically soluble fibers, in the form of fresh fruits and vegetables, whole grains, things like that. We know for a fact that these are good for gut health. And we know that it generally decreases your risk for colon cancer. So high fiber diet is very important. I recommend 3 to 5 servings of fruits and vegetables with whole grains and so on every single day for my patients. If they cannot tolerate those things for one reason or another, fiber supplementation in the form of things like Metamucil or Benefiber, there are many different ones out there. I think that's very important.
Sugar, which is my favorite thing in the whole world. And I don't believe anything that anyone says. I'm sorry. I'm not giving up my sugar. But it does cause shedding of the hair.
Yeah. So we think that sugar can play a role, again, in this microbiome dysbiosis. What does all that mean? Again, there are these bacteria, both good and bad, within our gut, within our GI tract. The interaction between these has a huge impact on the absorption and the digestion of our foods. We think that sugar kind of plays a role in creating an imbalance between the good and the bad such that it affects our absorption, and that can lead to hair shedding and other issues.
Is it like you're talking about people that all day long they have sugary stuff? I mean, I'm talking about is it possible to seriously, because I think I am a sugar addict and I'm constantly working on it. So you're not talking about a diet totally
devoid of sugar? No, I don't think so. I think this is more for, like you said, for our people that are having multiple servings of sugary things every single day. Sweets, desserts, things like that. I'm personally not a huge fan of these sugary, carbonated beverages and things like that have multiple servings, more sugar than we should probably, So those type of things I think you should avoid.
How come that causes nausea? I'm sorry, the diet Cokes or the diet drinks, how come sometimes
I think that has to do with some of the chemicals that they use in order to kind of sweeten at times. That can potentially lead to that. It also can cause bloating. So we know that bloating can potentially cause that feeling of feeling uneasy and even some nausea at times. So I think that plays a role there.
Dairy. Talk to me about dairy. Some people say it's the most amazing thing. Some people say it really bothers them. Some people, doctor says don't do it. Some people say yes, do it. It's good probiotics.
So dairy is important, I would say, but it's not for everyone. Okay. I feel like that's the motto for today. So if your body can tolerate dairy in the form of, things like yogurts and milks and so on, I think it's important to have those type of things. I want to be very clear. So low-fat milk and low-fat yogurt and things like that. Very healthy, very nutritious. It's a great source of calcium and vitamin D. I think these are great things to have. But again, it's not for everyone. People that have certain types of, lactose intolerance and so on, there are other ways in which they can get their source of calcium and vitamin D. So, and probiotics, as you mentioned. So yes, they are a good source for that, particularly certain types of yogurts. But I would say that you have to kind of weigh the risks and benefits or weigh the pros and cons of having these type of things. If you find that you have GI upset every time you have those type of dairy products.
What's in that dairy product that causes bloating?
These patients that don't have that particular enzyme or the lactase that we were mentioning that breaks down these type of foods causes as a byproduct this type of gas. And we know that gas accumulation within the gut, within the stomach and the small intestine and so on can cause that type of bloating that we're discussing.
Another favorite subject of mine, acid reflux.
Yeah.
It's so many people are suffering from it. Do you think it's about food, or do you think it's about lifestyle, or do you think it's also connected to stress?
You hit on some of the main points. So it's multifactorial. I think that there's not only just one thing here at play. I think dietary indiscretions play a huge role. What does that mean? So we all think we maintain a very healthy diet, and I'm not saying we don't, many of us do. But here and there, as human beings, we cheat. At least I can only speak for my patients and myself. I will say myself even once in a while. And I think that can potentially lead to certain aggravating events of acid reflux. And then again, as we mentioned, I think there are certain trigger foods like fatty fried foods, carbonated beverages, these things, even caffeine, believe it or not. Excess caffeine, not small amounts, but excess caffeine can play a role here as well.
I want to take the insurance out of this equation.
Sure.
Endoscopy and colonoscopy.
Mm-hmm.
Colonoscopy is every 5 years. Some people every 3 years when they have issues or they have polyps, correct?
So colonoscopy, if you look at the guidelines, it's dependent on, it can be as infrequently as every 10 years, believe it or not. So if you have your average risk, you have your first colonoscopy at 45 years old and you have no polyps whatsoever and no family history, then the guidelines suggest that you can actually, and it's a high quality examination, that's very important. The guidelines suggest you can repeat in 10 years' time. If you have a family history of colon cancer and a first degree relative below 60, then yes, you are correct that every 5 years you should have a colon. Endoscopy does not have the same surveillance guidelines, believe it or not. Does not. So there are a few indications where surveillance endoscopies are recommended. For instance, in the case of Barrett's esophagus, which we mentioned earlier, which is that precancerous condition in the esophagus, there are strict guidelines as to when you should repeat another endoscopy. If you have something that we call gastric intestinal metaplasia, which is a precancerous condition in the stomach, that too may require some amount of surveillance endoscopy. But in general, for the routine average individual just getting a regular endoscopy, there is no set guidelines for repeat endoscopy. No.
What is one belief you held early in your career about diet, weight, and gut health that you know now was simply wrong?
So I think that I used to think that any way we can lose weight is great and is effective. But I've come to realize that it actually does matter how we lose the weight and the mechanism by which we lose the weight. Because I say that to say that there are certain types of ways in which we can lose the weight quite quickly, but you can regain it quite quickly as well. So it's important how you lose the weight, the mechanism by which you lose the weight, and to be very consistent and very diligent. I'm not a personal believer of quick fixes. I'm really not. I think that you really need to focus on your body, and it's not that not everything works for everyone. There is certain things that, this is why tailored patient-centered approach to medicine is very important to me. It's not a cookie cutter mentality. It's not one size fit all.
You're known to be very compassionate.
If at the end of my career I'm known as someone who cares for his or her patients, or cares for his patients, is compassionate, and does things for the sake of the patient and not for economic purpose or financial purpose, I will be very happy with myself. I want to be known as someone who, again, cares for his patients, puts his patients first.
Well, you're already there, that's for sure.
And if I can, if that gets across, then I'll be very happy, and I'm very, blessed.
I want to thank you from the bottom of my heart for you to take time and talk to us today. We would like to gift you Jadu magic drip, which your wife has used. She actually loved it, and I know you used it as well. So for the people that are out there that have not used Jadu, magic drip. As like everything else, it's chemical free, and it really does magic to the scalp. Really, truly does. Really appreciate your time with us.
Thank you.
Yeroushalmi.
Thank you so much. I appreciate it. It's been a pleasure.
Thank you so much.